Well, there's no doubt the pandemic is taking a toll on mental health. The burdens of isolation, coupled with serious anxieties over health and finances, can be overwhelming for so many. From difficulty sleeping and eating to an increased use of alcohol and/or drugs, people are coping in a number of good ways and some not so good. Psychologist Dr. Betsy Stone joined me this week to talk more about how this trauma is impacting our bodies, our brains, and relationships.
What are the biggest challenges for most people at this point?
Well, there's a couple of challenges. Challenge number one is that loneliness is actually really bad for us physically. It's bad for our immune systems. People are feeling both lonely and trapped. And you can be lonely you don't have to be isolated to be lonely. We can be lonely with other people, which leads to one of the other issues that we're seeing right now, which is that there's way too much intimacy for some people in their living situation. Most of us never expected to spend 24/7 with the people we live with, and here we are in much closer contact in smaller spaces, and having to get to know and navigate those relationships in a different way. That's very complicated for most of us, and I think probably leads to some increased strife.
What can you do in a situation like that? Because we're stuck inside. So how do you navigate a relationship?
Patiently. The greatest gift we can give each other at this point is patience and time. We know that we're going to be under some form of lockdown for some period of time. Whether it's, clearly in Connecticut we're in phase one, but we don't know what that actually means. The uncertainty, the difficulty are things that we should tolerate in each other and in ourselves. This is a time to be kind and to be generous with ourselves and with other people. And it is a time to set the bar lower in terms of what we expect of ourselves and other people. Our children are not going to learn everything they would have learned in a regular school setting. All classes are going to be remedial to one degree or another whenever we go back. And we can't work at the same level that we were working in the past. So because we're taking care of children, because we're under duress, because we're anxious. So we have to be really kind to ourselves, and we have to be really kind to the people that we lived with. And that's not easy.
Now, you wrote a book on marriage. So, and there's a lot of talk about marriages coming undone at this point. What are you seeing?
Well, what we see whenever there's real stress in a marriage is that we're at choice points. We either move closer and become more supportive, or we create greater and greater distance. The distance doesn't have to be toxic. Not everybody wants to have a relationship that's incredibly intimate. But what we have to do is we have to think about what we need, ask for what we need, and to listen to each other without giving advice or being judgmental. I think it is very easy for people to say, it's worse for me, or you don't have the right to feel the way you feel. There's no question in my mind that's not helpful. If I feel badly, for you to you or me to layer shame on top of my bad feelings doesn't make my bad feelings go away. It just means I have bad feelings and shame.
Now, with kids, this summer, a lot of people expected their kids to go to camp, or the schools were at least going to come back in June. That's not the case in many places.
Mm-hmm.
How should parents be dealing with this?
Patiently and slowly. In fact, our children have had a real loss, and each one of us is entitled to grieve when there's loss. It is really important that we not try to remove that, because what we're then basically saying to each other is, your grief and your loss are not interesting to me. Well, I need to know that when I'm hurting, that there are people who care about me. So I go slowly, set the bar low. I keep using this analogy in my work. C is average. And I think that the best we do in a crisis, an ongoing crisis like this, and the fact that it's an ongoing crisis actually makes us much more fatigued. The best we do is average. So don't expect to have the homework be the best homework, to have the work be the best work, to have the food be the best food. Shoot for something doable so that you can feel good about yourselves.
And so many of us have older parents, and it becomes very confusing about when to see them, when not to see them.
Well, at the beginning, what we saw was a lot of older people saying this isn't really important, and people in the sandwich generation were actually saying, no, I want you to take this seriously, and parents were not. That seems to have gone away to some degree. I mean, the number of deaths is so extraordinary that it's really hard to say it's not serious. There are lots of fears that we have for our parents, and it is so unlike human beings to respond to being afraid by withdrawing from the people we love. We tend to move towards the people we love. This is really hard to do. It's hard to manage, and it's hard to manage my own feelings about. I think that most of us know that the people that we love who are over 60 are people we should stay away from. And that's a very difficult thing to do. It's difficult for grandparents to stay away from grandchildren. And yet that's the manifestation of love. If I don't come to see you, it may be the best message that I really care about you.
Is there anything else that we haven't talked about today that you wanted to share, or perhaps your own personal feelings about going through this experience and continuing to go through this experience?
So I think the most important thing for us to all be thinking about is that this kind of prolonged crisis creates all sorts of physical as well as psychological impacts. I don't think we're going to know what this did to us until we're way far on the other side. So don't judge yourself. Understand that aches and pains are actually part of living with grief, and that's what we're doing right now. That not thinking clearly is something we ought to be forgiving yourself for, because we're not thinking clearly. In my family, we're calling this COVID brain. And I think it is pretty typical for people to not be able to focus and not be able to think and to be filled with aches and pain. Don't be mean to yourself. This is an opportunity for us to actually be kind to ourselves and kind to other people. And without that, it will be much harder.
Well, Betsy, it's been a pleasure speaking with you. Thank you so much for your advice, and I hope that you stay safe and healthy.
Thank you. You too.
If you or someone you love is in need of help, you are not alone. The National Distress Hotline is 1-800-985-5990.